Hello, good afternoon. Yeah, welcome everyone to our Facebook Live again on every Wednesday, once a week. Yeah, 1 to 2 p.m. is our time here today to share with every one of you regarding more informations on how to live beautifully. Yes. So today's our topic is talking about melasma, and I welcome all the patients, all the people who have melasma issue. Welcome, and together we discuss about this topic. And today I will show you and explain to you all the important points and understanding that you should know about melasma, so that you will be able to understand your problem and also some of your misunderstanding or idea about melasma. Yeah, sometimes you've gone through something on your melasma, meaning to say you probably gone through some treatment, but you found it not effective. Yeah, why is it so? So today's way of live will be more on the questions and answering. So beside questions that I prepared, so we are also welcoming all your questions from the floor. And again, I welcome every one of you to join our Facebook Live today. And please share to your friends and your relatives if it is related to them. Yeah, thank you very much. Our aim is to help more people, yeah, in an educational way, so that more people understand about melasma more, and also more people will be able to get the right treatment for themselves. Yeah. So again, I'm Dr. Jeff from Revival Clinic. So I thank you and appreciates everyone's effort to join our Facebook Live today. And today's let's begin our presentation on this melasma. Okay, so whoever have gone through or having melasma, yeah. So these are the questions that I would like to answer. I think these are the questions that always in your mind. Yeah. So probably I would like to clear your doubts, before you really look for treatment. So that's why today's presentation's topic is, if you're having melasma, you should know this before treatment. So these are your doubts that actually we do deal with a lot of our patients. So these are the doubts that we clear for them. Once they understand the pictures, subsequently when they choose for treatment, when they decide for treatment, those treatment will be more effective or more suitable for them. Yeah, and ultimately the outcome will be more successful. Okay, so first start today's slides topic. Yeah, we welcome all the patients with melasma. Yeah, if you do not have melasma, you are also welcome to listen to our live topic today, because this is an educational topic, so that more people should understand and get to help more people around us. Yeah, melasma is a common issue, especially in Asia, because this is a problem with the Asian skin type. So it is a very common condition. It can happen in the female as well as the male patient. So it's not only female. So even younger patients also can have melasma. So it's not a very uncommon things around us. Yeah, probably around us, our wives, our sisters, our mothers, our aunties are having melasma. So you probably are dealing with this problem. Yeah, you probably one of it, and you are probably likely to be one of it. So how do we handles it or deals with it if we have a melasma? Or how can we help our surrounding friends and relatives to deal with it if they have a melasma? So these are the questions that always come in the mind. So we will like to answer one by one. Okay, question number one. There are always a patient will ask, okay, I know I'm having melasma, right? Probably she have Googled some internets, or so she has also, or she or he or also already consulted doctors and been diagnosed with melasma. So then what will be the treatment suitable for me? So these are the questions that usually we get from our patient. Our patient will say, oh, I know I'm having melasma. So what are the treatment that you are having and available for me? Okay, so for these kind of conditions, what we can understand is the patient, he or herself is not really understanding what is melasma. So melasma treatment, you need to go accordingly to the characters. So here I listed down 3 characters of melasma that we need to analyze on each patient with melasma. Okay, we emphasize, I repeat, each patient with melasma, before we start recommending and starting any treatment, we need to determine the severity level of these 3 main problems of melasma. What is underlying the melasma? First is inflammations. There is the inflammation characters in the skin, that is part of the melasma. And another second factor is the dermal structure, or the collagen structure in the dermal layer of the skin is having a leakage condition. And number 3 is a pigmentation. Yeah, patient may have pigmentations, discolorations, deposits on the skin, and those pigmentation has a portion of immature and also portion of matured. And every one of the patient with melasma will have a mixture between mature and immature. So whether your portion is more on matured or portion more on immature, it depends. So these are the 3 main factors that we need to deal with if you are having melasma. So at this moment, I would say no any single treatment can treat all these 3 in one. So meaning to say, if you are having melasma, you need treatments that individually treat inflammations and also treat dermal structure collagens and also treat pigmentation. All this treatment has to be carried out, but probably at the different stages of time. Why? Because if your skin is having inflammations, then you should focus on inflammation first, and the rest of the treatment you cannot carry out yet. But you need to carry out later on when the skin has lesser inflammation. And once your skin is lesser inflammation, when you carry out the treatment, we need to be justifiable on terms in terms of the pigmentation. If it is immature, then we can skip and straight away start doing treatment for the dermal collagens leakage repairing. Or if it is a lot of mature pigmentation, then it's preferable to do some treatment that can target the mature pigmentations. And probably simultaneously, we can also do dermal structure collagen leakage repair. All right. So one from the floor, Sharon is asking, how I know my skin is melasma or freckles? Okay. So first question is, if you already know you are melasma, so if you have still no idea of what is a pigmentation or discoloration issue with your skin, so you are advisable to visit a doctor who is experienced enough to treat melasma and also dealing with melasma. And if like for us, we do have a technologies of treatments, technologies of scanning onto the skin to analyze, the skin conditions in detail, and then will give a better confirmation whether your skin is melasma or not. And also with the analysis tools itself, we also will be able to determine the severity of your melasma based on these 3 categories, which is inflammations, dermal structure collagen leakage, and pigmentation, whether it's mature or immature. Yeah. So we need to classify each single characters of a pigmentations, melasma, meaning to say inflammation level, is it like from mild to severe? The dermal structure collagen leakage, is it mild to severe? The pigmentation, is it mature or immature? So after we classify gradings, then only we will be able to know, okay, at the moment, what should you start first? Yeah, what treatment should you do first? And what treatments should come the next? And what treatment is a subsequent treatment that you need to do so that we can target all these 3 main problem of melasma. Then only your melasma can improve in a significant form and also in a good way of effective way. If you do not treat all these 3 and probably you are treating only one of it, then you probably see some improvement but not overall significant improvement. If you only treat one factor but you treat it in the wrong timing, then you probably see worsening of your melasma. So this is a tricky part of melasma when we're dealing with. So we need to have a lot of planning, analysis, and analysis and planning before we start any treatment. So come back to the question again. If you know that you're having melasma, what treatment is suitable? Before we decide for the answer is before we decide for treatment, we need to analyze your problems of melasma based on these 3 categories, grading of a melasma based on these 3 categories. Then we decide what treatment on what timing. So these are the things that we need to do before we can really definitely tells you what treatments you need to do or suitable for you. All right. And goes back to the questions from the floor just now, Sherin, is whether if you are not yet knowing whether your pigmentation issue is a melasma or freckles, get a doctor to diagnose it, best with a doctor with tools of analysis that actually can see in details and definite confirmation. And then Sherin also asked, can she use whitening cream to cure melasma? Okay, hold on, one by one. These are the questions that I already prepared that then we will also answer one by one, okay? So question number 1, if you are having melasma, you probably are rushing into what are the treatment, but the treatment or the way of doing it is, first step, we need to analyze, and determine the melasma accordingly to these three categories of factors of the melasma, because these are the three things we need to treat melasma. The tricky part of treatment in melasma is we need to treat three things, not one thing, okay? Not just pigmentation alone. So we need to treat three things. And these three things is integrating and sort of like disturbing each other. So inflammation can distort and disturb on the pigmentation. It can stimulate the pigmentations to form from non-matured to matured. And also the dermal structure collagen's leakage also can trigger the inflammations and also let the pigmentation to become more active. The immature pigmentation can deposit deeper if it is leakage in the dermal structure. So all these things are the considerations we need to see and to determine what is the best treatment that you should start first, then subsequently what next. So this planning is very crucial. Yeah. So to answer your question, is the planning accordingly to your characters of melasma is the solution to your melasma. All right. So next question. Question number 2. I have treated my melasma with latest. Yeah? So I have a patient asking me this question. She has treated her melasma with the latest picosecond laser technologies in the market. But why her pigmentation is getting worse than before? Yeah. So underneath the pico laser suppose now being advertised, telling a lot of people, the picosecond laser is the best tools to treat melasma. Shouldn't it be able to treat melasma? Right? So this questions is a real patient's feedback to me saying that her melasma treated with the latest picosecond laser, okay, but why her pigmentation is still worse, okay? Yeah. So the problem, the answer here is, okay, first of all, clarification, the patient is not treated with lasers under my hand, So, but anyhow, okay, she has this experience and her pigmentations get worse. So whether she really did the latest technology of pico laser is another thing to say, okay? But assuming it is, yes, then what will be the reason or answers why is her pigmentations getting worse? Okay, so the answer is still based on the basic principles. If your melasma treatment treated with picosecond laser, but is if it is on the wrong timing of the treatment, means the melasma is not really benefiting from the laser, but indeed it will be worsened from the laser treatment. Because if your melasma is wrong timing, where you have a lot of inflammation character underneath your skin that causes the melasma, at this point of time, your skin is not suitable to do laser. It will worsen the pigmentations. Or if you do have a very leaky, very severe stage of a leaky in terms of your dermal collagen structure, then you are not advisable to do lasers at this moment, even though no matter how good is a laser, so it will still breaks down the skin more than the pigmentations, and it weaken the dermal collagen structure more, and it makes your pigmentation worsen because it will triggers more inflammation after that. Yeah. Or if you do have a lot of immature pigmentation which underneath your dermis layer, but it's not obvious to be seen on the top of your skin. So once you did laser, the lasers can stimulate your immature cells insides, which hidden inside your cells in the skin, to break down and to come out from the cells and deposit more onto the surface of the skin, then or become matured. Okay, then this will make your melasma looks worse than before. So to prevent all this, best way is to analyze your skin with melasma, and to categorize whether your inflammations is a severe form or your leakage dermal collagens is a severe form, or if you have a lot of immature pigmentations. If you do have all these factors on hand and you know already, then you are not advisable to do laser at the first hand. Yeah. If you do not analyze your melasma, then you are taking risk of doing the laser without knowing whether the laser really benefits you or not. So these are the things that we always do for our patients to make sure that she has a melasma, even though it looks mild for her. But when we look under the cameras and also the scanning, there is always these factors appearing on the patient's skin, and these are the factors that we will determine to advise patient to delay the use of lasers later on, because if she does the laser at this moment, it will definitely cause her skin to worse in terms of pigmentation. And ultimately, when you did laser and it become worse, what will you need to suffer is you will be unhappy. You will need more money to treat your melasma. You will need longer period of time to treat your melasma. So these are the things that we want to avoid. We don't want to create to anyone. Okay. So the reason why your melasma is worsened after pico laser, because it is having this kind of characters, and these kind of characters can only be seen by a scan of the skin, and it cannot be seen just by looking from a naked eye. All right. So question number 2, okay. So ladies and gentlemen, if you do have any questions, you can also pop up to our comment column. I will answer one by one. If it is already prepared for my slides, I will try to go in sequence lah. Okay. So number 3, why my melasma relapse after some time? Okay. So it's also one of the common questions. Patients been treated well. So even though with my patient as well. So but patients melasma relapse after some time. Okay, so again, it goes back to the underlying principles of melasma. Most of the time, we found that the patient have leaky dermal collagen structure, has a higher chance of relapse in their melasma. Means they have treated their inflammation part, they have treated their pigmentation part, their pigment get lighter, their inflammation get lighter, but then the leaky dermal collagens due to the aging still remains. So this over some time, will makes us, the weaker part of the structure of your skin will stimulate again or let the inflammations to reoccur again. So this will cause the relapse, the chance of relapse in the melasma. Because most of the time when we clear the melasma or the pigmentations, with the inflammation lightening, so because patient were thought, oh, this is like already okay, but what is actually still ongoing in terms of the melasma is the leaky dermal collagen structure that is not being handled yet. This is the trickiest part of the melasma treatment, that always, because it's not able to see. You can't even see the, for example, pigmentation you can see, or color you can see, but this you can't see. You can only feel it, but whether you really appreciate it is another thing to say. Okay, so one question from before, from Fong. Unfortunately, most of the time, the girl doing the pico laser is just a cosmetic girl who is in unqualified. Is also another issue in Malaysia's market, is where a lot of centers are providing this service of pico lasers, in terms because pico laser has been so famous and marketed, advertised everywhere. So people thought that pico laser is a wonder laser, but this is a very good technologies of laser, but it's not wonder if you're not doing it right, especially if a cosmetic girl who are not able to handle laser in the proper setting, and also if they do it at the incorrect timing, meaning to say if your skin is having a lot of inflammation, if your skin is having a lot of immature pigmentations, and you do the laser at the point of time, your skin will become worse, rather than benefiting from a laser. So whether you are qualified person to handle the laser, also will still the same thing if your skin is not at the right timing. And things will get worse if your skin is worse or not at the right timing, plus the laser treatment is carried out by an unqualified cosmetic girl. So things happens in Malaysia market. This is the reason we do this educational live topic, is to let a lot of people more realize, to let more people realize of what the kind of like scenario they may deal with. So try to avoid yourself getting into these scenarios. So hopefully hope everyone's be careful. Okay. Melasma still need to be treated, but we need to treat it in a proper way so that you will be able to really benefits and worth the money you spend for the treatments that you did. All right. So again, today's topic is for everyone with melasma. We welcome everyone who have melasma. Stay tuned with us. I will answer all the common questions that you probably been having, but you never really get answers for it. So I hope that I can give you a proper answers and proper solutions. And please watch until the end if you have time together with us today. Okay. So again, goes back to our slides. So the question number 3 is why the melasma relapse? The reason is because you have a very weak or leaky dermal collagen structure. That's why most of the patients with melasma, regardless whether they have treated their melasma well or they are ongoing in the progress of treatment or lightening their pigmentation and inflammation, we always encourage patients to start doing some treatment that can improve, and treat the dermal collagen structures so that the leaky characters of the dermal collagens can be repaired. This is a very scientific terms, but to understand easier means you have a dermal collagens fibers, in your real skin layer, but these collagens got a lot of loopholes. These loopholes are giving the chance for the inflammation to start and also pigmentation to forms. And also these are the leaky characters that your melasma recur easily. So we need to strengthen it, we need to repair it so that the collagen structure become more stronger without much of leakiness. So treatment, later on we'll talk about what are the treatment. So these are the idea or the reason why your melasma relapse. Okay. So again, question number 4. Okay, a lot of patients may have impatience to treat whenever they are dealing with melasma. Yeah, I'm sorry to say because a lot of people thought we are like earning a lot of money. We are like trying to delay the treatment, trying to slow down so that we earn money more and more. It's not in the way, but it's because melasma, we need patience to treat. We need a lot of patience. We need to monitor. We need to see the progress. We need to find the right timing. Yeah. So melasma treatment, usually we will at least try to encourage the patient to at least ready to be around 9 months to a year, or if possible at least 2 years. Don't rush into like solutions. Okay, you are actually already doing treatment, but don't rush into just seeing cure in a short period of time. Melasma can be cured if you give enough of time. If you don't give enough of time, eventually you are halfway through and you relapse the whole thing and you need to start all over again. So melasma usually needs at least 1 year to 2 years to get a proper improvement. So because we need to target all these three factors, which is your inflammations, your leaky collagens structures, and also the pigmentation. So in terms of if we do see your pigmentation issue, which is weaker in the sense of dermal collagen structure, especially, the longer it takes. So because usually the patients with weaker or more leaky dermal collagen structure, the more inflammation they are, the more immature pigmentation they are. So they will need to spend a lot of time or longer time for the pigmentation to lighten and also inflammation to lighten. So then only when they carry on with the leaky collagen structures improvement, then again will drag on certain time. So this will sort of like takes a little bit longer, but ultimately we are establishing something. We are really targeting into the root cause of the melasma. So unfortunately, because a lot of people do not understand, so and they thought like once they are lightening being visibly lesser, they thought it's done already, then they stop to carry on the treatment. Then the dermal collagens weakening still remains, and then the lightening, the pigmentation and the inflammation sort of like recur again after some time. Then you have to start all over again. So these are the challenges and the tricky part of a melasma treatment. And we try to explain to more and more people, hope everyone understand this is the fact we need to accept in terms of melasma. So we need to treat accordingly to what the problem is. It's not miracles, it's everything based on the facts. So the reason why you need longer treatment is because your structures of your collagen is weaker. All right. So another common question that we get from the floor, okay, is melasma curable? Will melasma be cured? Okay. So I also getting these questions a lot from my patients or from a lot of inquiries. So will melasma be cured? Okay. So the answer is yes or no. Okay. The answer actually depends on your characters of melasma. When we analyze your melasma with our scanning tools, if we do find your inflammation is less, or if you don't have a lot of dermal collagen structure with leakage, then probably easier to cure. All right. But if you have inflammations and pigmentations, especially immature pigments, a lot on top of very leaky dermal collagen structure, then probably quite hard. We need longer. It's not saying impossible to cure, but we need even longer period of time to establish the repair on the leaky dermal collagen. Then only your inflammation and pigmentation will get controlled by itself. Then it will be able also to achieve a cure or stable stage for your melasma. So it will be harder because of it takes longer time, longer session, more sessions of treatment, and also in terms of monitoring, we need to be even closer to get the right timing. The right timing is when your skin is necessary to do something, we need to do at that timing. If sometimes you miss it, then probably later on it's not suitable again to do. So these are the right timing we always miss because patient do not understand. So we are always unable to do the right timing whenever it is right for the patient. Okay, so these are the things that we deal with. So again, goes back to the questions: will melasma be cured? Yes, if it is inflammations and pigmentation malform. If it is severe in terms of dermal collagen's leakage, it always comes with severe inflammation and pigmentation. Then it will be slightly longer, more challenging, but still ultimately, if is monitored and do it in the right way, it will still be able to cure. Yeah. Okay. So question number 6. Can I treat melasma without laser? Yeah, goes back to the questions from Sherin just now. Means can use whitening cream to cure melasma? Okay, I think it's a similar questions. Yeah, just if you don't want to use a laser, you want to use just a topical cream. Can we treat melasma or cure melasma? Okay, the answer is very logic based on the fact again. Okay, melasma, if you are having inflammation, you do not need lasers. Laser do not help anything on the inflammation. But there's one tool that actually can help to lighten the inflammations. Besides medications and cream, you can do a treatment called yellow laser or yellow light, we call it. So this is more on anti-inflammation or lightening of inflammation in terms of in the melasma condition, in combination with medication and also topical cream to reduce inflammation. So for patients who do not like to do laser, okay, again we need to go back to the principles of the problems. Yeah, if they have inflammation, they do not need laser. Laser does not help. They need treatment with medications and cream. And if their inflammation is on the severe form or they would like to see faster improvement, then yellow light is one of optional to add on top of medication and cream. So if the condition has a significant leakage dermal collagen structure, then also laser is not the recommended form. Yeah, you need something that actually can stimulate the basal cells membrane on the skin to build back the collagen. And the best technology to be used now is radio frequency, come with micro needling. So it's a micro needling radio frequency, and the latest design in the market is called Potenza. So anyone who like to treat their melasma in the ultimate way and ultimate effectiveness outcome, then the Potenza is one of the interesting and very exciting treatment that we are having now. And of course, if you are having a lot of immature pigmentation, how do you know? You can't see by yourself. You have to determine through the scan. If there is a lot of immature pigmentation, no point, and don't use laser to treat it. It will worsen it. And on the other hand, if you have a lot of mature pigmentation, this is the only indication we will recommend our patient to do laser. And this recommendation timing is also when your skin has already settled down in terms of inflammation and also already reduced significant amount of the part of immature pigmentation, and the leakage dermal collagen at least is not in the severe form. If it is severe form, even though your inflammation reduced, your immature pigmentation reduced, but the mature pigmentation lasers that you do can only be carried out in the gentle form. Probably you need a lot more sessions, a few more sessions to carry out for the same effect compared to those people who have stronger dermal collagen structure. Yeah, all right. So these are the points, factors that we need to determine while we do the treatment for melasma. We monitor for your melasma condition. Okay. So another hand, if you have this question in your mind, can I cure melasma with laser alone? I think these are even more common sort of like idea that people having. So because there are a lot of advertisement everywhere in the centers are saying they have a best laser on the market, the best, the leading, the best treatment for the melasma, with pico second laser, pico what, all this brand of a pico laser. Ultimately, as a consumer, you do not need to know what are the pico brand. You do not need to go and see whether their laser is the best or not. Because picosecond lasers design of each technologies has its own advantage and disadvantages. So nothing beats each other. So the price only different, okay, because of the cost. But eventually, almost all of the pico laser blended one are expensive. Okay, the good one are expensive. Yeah. So no matter how, okay, the answer to cure melasma is not laser alone. Yes, you cannot cure your melasma with laser alone, because underlying the melasma, there are three things we need to treat. Only the pigmentation can use laser to treat as part of treatment, and it is not all. Laser do not reduce inflammation. It just assists into lightening or softening of the inflammation, or sort of like controlling the inflammation together with medications. And also leaky collagen structure, we need radio frequency. Comparing to lasers, certain lasers do have a certain amount of repairing on the leakage collagen structure, but ultimately it's not as strong as compared to micro needling radio frequency technology. So leakage collagen structures still uh, unable to be treated well with laser. And of course, immature pigmentation is still not recommended to do laser. So you can't treat all the factors. You can't treat all the factors in melasma with just laser alone. So answer is no for this question. Can I cure melasma with laser only? Cannot. Okay. So, but melasma can be cured, yes, if you are able to treat all the three factors: the inflammation, the leakage collagen structure, and the pigmentation, whether it mature accordingly to the way. So if you treat all these things, your melasma can be cured. But why still not many people can cure their melasma? Because their leakage collagen structures is not being taken or treated. So treatment of the leakage of the collagen structures takes at least 2 years to repair. So it's not as simple as like 6 months or 3 months to see effect on that. So within 2 years, when you're repairing, your melasma still may recur in between. So these are the challenges that we need to monitor. Whenever your leakage of collagen still have not fully repaired, so the inflammation, the pigmentation is still active. So in between, you may have some relapse. So you still need some medication, some cream, or some treatment to assist to control your condition until the leakage of a collagen structure become repaired. So sometimes the treatment has been done, but while waiting for the result of the repairing, so it takes even sometimes 2 years. So we need to have some patience to wait. And within these 2 years, when you are having a lot of relapse, it's possible, but ultimately it will go off. So that's why we need to be patient. And whenever you relapse, you need some treatment targeting your inflammation or pigmentation part accordingly to control it. So then meanwhile, you are waiting for the repair of your collagen structure. So these are the idea that we need to understand while we treat melasma. Okay, and this is a tricky part, because if you don't understand, you don't get the right idea and timing why we do so. Okay, so why should I see a doctor for? Okay, another question. All right, so back to a question just now. Okay, can I cure melasma with laser? No. Okay, let's proceed with question number 8. Can I? Why should I see a doctor for melasma? Can I see just a beauty salon? They also know pigmentation. They can recommend pigment cream, facials, ampule, and they can show you a lot of photos who have even improved a lot significantly in their pigmentation or melasma with their treatment. Why is it they are able to do so? Why should I see a doctor to treat a melasma? Okay, so you see, these are the questions that probably in your head, in your mind, you've been thinking about. And also, there are a lot of new clinics opening up, and there are many beauty laser facial products being advertised and got first trial. Why I can't try that? Maybe my melasma not so severe, and just try one time and it probably already cured. Then no need to waste money, right? Also, okay, thank you for this question. Sharing is saying they recommend peeling treatment. Is that okay? Yeah, sometimes peeling treatment also quite fantastic and in good effect to treat melasma already. Yes. So is it correct or not? Okay. So melasma is very tricky. Okay. Still based on these three principles: inflammation, collagen structure leakage, and pigmentation, mature and immature. The timing is very important. If your skin have no significant inflammation and the collagen structure leakage is not significant, and you do have some mild matured pigmentation, yes, peeling will do well. Yeah, then you will see fantastic result. Yeah, but most of the time when you are getting older, your skin structures are becoming aging, your collagen structure leakage will become more significant, then the inflammation will become weaker and more obvious. And at this point, if you do lasers, yeah, without analyzing, you probably will have a worsening of pigmentation after the treatment. Okay, and of course, Sherin Song is saying, but after peeling, skin very red and thin. Okay, if it is properly done, some redness and sort of like thinning is normal. After a while, the skin will recover completely. But if you do the peeling at the wrong timing, where when your skin with melasma is having a lot of inflammations and leaky collagen structure, then this redness and thinning effect will last and continuous and persist. Then your skin will stay on sensitive afterward. So these are the things that we need to avoid. How to avoid? Proper analysis and determining the characters of melasma is important. It's not only to get the proper or exact proper questions that you treatment that you need, but it also prevents you from unnecessary complications from wrong choice of treatment. So again and again, we need to monitor the patient's skin in terms of melasma conditions, either inflammation, collagen leakage, pigmentation, the timing to plan the treatment just right for the optimum outcome and effectiveness, and at the same time to target each factors of a melasma in a sort of an integrated way. So because these three factors are sort of influencing each other, so we need to break the cycle. We need to target these factors in the melasma one by one. So these are the things that in our mind when we are dealing with melasma. So I'm sharing here is also to share to more doctors who are dealing with melasma in their practice, so that they are also able to use the same concept to treat more patients with melasma, so that it benefits more people. Yeah, my idea is to help more people only. So the thing is, the understanding and the melasma evidence base has already been there, but nobody really doing it right way. So these are the way we are doing, and we would like to share with more people that more people can do it in the right way to help more people with melasma. All right. So number 9, okay. Is melasma due to hormone, sun exposure, yeah, or due to age or any particular cause? Yeah. So these are the questions that this is also the questions that I always get from my patients. Yeah. So okay, the answers to this question is actually okay. These factors, whether it is a hormone, whether it's a sun, okay, or cosmetic products, whatever, it's just a triggering factors. Means you, if your skin already in the melasma character with inflammation and active pigmentations and collagen weakening, these are your biological aging condition that causes the melasma. And the sun exposure, the hormone triggers or menopause changes are just additional triggering factors to worsen the melasma. Yeah, but it doesn't cure the melasma by avoiding sun. It doesn't cure the melasma by not having menopause. So it doesn't cure the melasma. Okay, it just reduces the stimulation on melasma. Okay, so that your melasma looks milder if you avoid these triggering factors. The main cause of the melasma is still a biological aging with weakening of dermal collagen structure leading to leakage. So these are the things that we are dealing with melasma. So yeah, so I hope your question is your doubt is clear. Yeah, it's not due to hormone but triggered by hormone. It's not due to sun but triggered by sun. Is it due to age? Yes, it's part of an age factor that causes the dermal structure collagen leakage and then the inflammation. Yeah, and also the other factors, cosmetic products, skin care, yeah, it's just additional triggering factors for melasma. All right. So okay, another questions. So if it is an aging factor, then why is it necessary to treat melasma? Okay, and some more, if we are going to treat all these three factors of melasma, it will be involving quite a significant amount of cost. So is it worth to consider treatment in melasma? Okay, so my answer to all is yes, I agree it is quite costly to treat melasma, but it is also worth in the sense, if you would like to prevent aging. Okay, because once your skin is having this character of melasma, which again I emphasize and I emphasize, which are the three factors, especially the leakage of your collagen structure. That weakening of your skin is one of sort of like a killing part of your skin. It makes your skin age faster than the rest of other people without melasma. So if you let your melasma carry on, means you are letting the collagen structure leakage carries on. It creates a lot of inflammations in your skin, and your skin is aging faster than the rest of other people. Then your pigmentation will get worse over time. Your skin also will tend to become thin and sensitive by itself, and you will start to form age spots. So if you do see people who have one patch of red or one patch of black spots, yeah, like one spot. Sometimes you call it sunspot, yeah, or age spot. These are the characters of your skin melasma when it is gone too far or a bit severe form. Okay, so when the melasma is severe, when your skin is thin, then usually you will start to form all these age spot. So it is a little bit advanced stage of melasma already in that sense. So to prevent, this from happening, it is quite worth it to treat melasma, especially if you can treat in the earlier stage. Is better because it will save you some cost as well. All right. So okay, Sherry is asking, melasma can get by genetic. Melasma is actually inherited through genetic, means your skin type, is inherited through the genetic, and then your skin type is more prone to certain sense of aging and leakage of collagen structure. So this sense is inherited. So sunblock is very important, right? Yes, sunblock is very important to reduce the triggerings on the melasma. Because if you do not apply sunblock, the sun exposure will triggers more on your melasma. The inflammations will get worse. The pigmentation will get more matured, and your pigmentation will become more obvious, and your speed of worsening of your melasma also increases. So it's very important to use sunblock as well. Okay, but ultimately you still need to treat melasma, because I will still recommend to treat melasma because it gives you a full care of your skin if you treat it well. If you don't treat it, it actually speed up in terms of aging, if unless you don't care about your skin anymore. But please take care of your skin, right? Yeah, please don't take care. Please don't take care of your skin. Okay, yes. So I wish everyone okay, sort of like understand. Okay, and I hope you at least get some idea right for your melasma issue. Yeah, so if you do learn something, and if you still have some questions, please type out your questions in your comment. I will answer it now. Yeah, and if you find this live topic is very informative or interesting, please share it to your friends, or you write your comment, thank you very much, whatever. Yeah, at least more people can see this live show, and it will benefit more people. Yeah, and also I encourage those doctors who are also doing melasma treatment for their patients to see this live information that they can understand about melasma more. Yeah. So, and I hereby wish every one of you stay beautifully, live beautifully, and cure your melasma in a successful way, in the earlier form. Okay. Okay. So I wish you a happy weekend, happy holiday. Yeah, today is still Wednesday, so another 2 days to work before is weekend. But anyhow, I will see you again on next Wednesday, same time, 1 to 2 p.m. Another topics to discuss about beautiful life again. All right, thank you very much, and I see you again. If you are interested to know more about your melasma, or if you are interested to understand more on your skin, whether it's a melasma or not, if you are interested to get your skin problem scanned, with our setting here. So you are welcome to get in touch with us in Revival Clinic. We are now based on Kota Kemuning, and our contact number is 017-781-5237. And also the website and emails you can contact with us. Yeah, so you can screenshot these slides and get in touch with us. anytime as your convenient. All right. So again, I wish every one of you stay beautifully and see you again on next round. Thank you very much. Bye bye.